Diabetes is a condition where the body has difficulty managing the amount of glucose in the bloodstream due to changes in insulin production or effectiveness. Chances are someone you know has diabetes. In the United States, the incidence of diabetes is growing with 1.5 million new cases every year. There are currently 30.3 million Americans with diabetes. That is about 9.4% of the population. The problem is that out of those 30 million, 7.2 million are not diagnosed and likely not receiving the care they need. Those individuals may be unaware because the symptoms are not the kind of problems that have you running to the doctor. Symptoms include frequent urination, dehydration, increased thirst, blurred vision, hunger, weight loss, and fatigue. But let's face it, when was the last time you ran to the doctor because you were tired and losing weight? And if you're dehydrated, you drink more, resulting in more frequent urination. That's not alarming at all. The symptoms of diabetes seem somewhat common and may easily go unnoticed. There are three categories of diabetes, including type 1, type 2, and gestational. Type 1 diabetes was formerly known as insulin dependent and juvenile onset, while type 2 was called non-insulin dependent and adult onset. Over the years, there has been such a crossover with more kids being diagnosed with type 2 diabetes and more treatment of insulin with type 2 that we now differentiate these conditions by type 1 and type 2. We will focus our conversation on these first two types of chronic diabetes that are not specific to pregnancy. Let's start with type 1. Only 5 to 10% of the diagnosed cases of diabetes are type 1. It is considered an autoimmune disorder where the antibodies of the immune system mistakenly attack healthy tissue in the pancreas, resulting in destruction of the beta cells that produce insulin. Individuals are left with declining synthesis of insulin to the point where there is little to no insulin produced. Because the job of insulin is to allow glucose into cells, when insulin is not present, glucose remains in the bloodstream. Levels of glucose can rise to alarmingly high amounts. Individuals with type 1 diabetes will not go undiagnosed. Eventually, the symptoms of glucose will rise so high that symptoms are normally pretty severe. Nothing can be done to prevent your risk of type 1 diabetes. Researchers are still discovering why this autoimmune disorder attacks pancreatic cells. There is a genetic link, and it is believed to be triggered by environmental factors such as an infection. But it will take much more research to truly understand this condition. Let's shift gears to type 2 diabetes. With type 2 diabetes, the cells are resistant to insulin. In other words, even though insulin is present, it won't allow glucose in. It is believed that the insulin receptors become oversaturated and unable to signal the cell to let the glucose in. Glucose cannot enter cells when the insulin receptors are not working, so blood glucose levels rise. In turn, the pancreas responds to the high blood sugars by producing more insulin. Eventually, the pancreas can become overexhausted and unable to produce adequate insulin. This makes treating type 2 diabetes more challenging because the condition can include both impaired insulin action as well as adequate production of insulin. Unlike type 1 diabetes, type 2 has several modifiable risk factors, including weight management and adequate exercise, that can help combat one's risk of developing the condition.